Now we are going to see the branches of the subclavian artery. First, in arch of aorta, the right subclavian artery arises from the brachiocephalic artery. In right side, the brachiocephalic artery divides into right subclavian artery and right common carotid artery. But in left side, there is no brachiocephalic artery. The subclavian artery and common carotid artery directly arises from the arch of aorta. Now we are going to see the right subclavian artery. The first division is the vertebral artery. Vertebral artery has 4 parts. First part extends from origin to 6 cervical vertebrae and has no branches. Second part extends from 6 cervical vertebrae to foramen transverse area of atlas, and it supplies spinal cord, meninges and vertebrae. Then the third part extends from foramen transverse area of atlas to posterior atlanto-occipital membrane. It supplies suboccipital muscles. Fourth part extends from posterior atlanto-occipital membrane to the lower border of pons. Along with vertebral artery from opposite side, it forms basilar artery. It supplies meningeal branches, anterior spinal artery, posterior spinal artery, posterior inferior cerebellar artery, then medullary arteries. Next, coming to internal thoracic artery. The branches are divided into 2. First one is anterior intercostal arteries. Then it extends into superior epigastric artery. It supplies the upper part of rectus abdominis muscle and it anastomoses with the inferior epigastric artery. The next one is pericardiophenic artery. It supplies pericardium and diaphragm and it extends into musculophrenic artery. The musculophrenic artery supplies diaphragm, lower intercostal muscles, that is 7th, 8th and 9th, and abdominal muscles. And there are some sternal and perforating branches are seen in internal thoracic artery. Then the next one is thyrocervical trunk. Thyrocervical trunk divides into inferior thyroid artery, transverse cervical artery, suprascapular artery. Now we are going to see the inferior thyroid artery. Inferior thyroid artery divides into ascending cervical artery, inferior laryngeal artery. The ascending cervical artery supplies neck muscles and some spinal branches, and the inferior laryngeal artery supplies laryngeal muscles, particularly below the vocal fold, and it anastomoses with the superior thyroid artery. There are other branches of inferior thyroid artery. These are pharyngeal, esophageal and tracheal branches. Now coming to transverse cervical artery. Transverse cervical artery divides into superficial cervical artery, dorsal scapular artery, that is deep cervical artery. Superficial cervical artery supplies superficial muscles of posterior neck, brachial plexus and trapezius muscle. Dorsal scapular artery supplies levator scapulae muscle, rhomboid muscle, anterior scalene muscle, scapular region. Now the next is suprascapular artery. Suprascapular artery supplies various muscles like sternocleidomastoid, supraspinatus, infraspinatus, subclavius, and the skin on the upper chest. Then the next one is costocervical trunk. Costocervical trunk divides into deep cervical artery, supreme intercostal artery. Deep cervical artery supplies deep cervical muscles and posterior vertebral muscles. Supreme intercostal artery supplies skin, muscles, pleura of first and second intercostal spaces. Here is the summary. First, the right subclavian artery divides into many branches. One of the branches, vertebral artery. Vertebral artery from the opposite side, along with it forms basilar artery. Then internal intercostal artery. Internal intercostal artery divides into 2 branches. One is pericardiophenic and it extends into musculophrenic artery. Then the next one is anterior intercostal artery. It extends into superior epigastric artery. Then the next division is brachiocervical trunk. Brachiocervical trunk divides into 3 branches. One is inferior thyroid artery. It again divides into 2 branches. One is inferior laryngeal and ascending cervical, and other branches are laryngeal branches, tracheal branches, pharyngeal branches. Then the next branch is transverse cervical. It divides into superficial cervical and dorsal scapular artery. Then brachiocervical trunk divides again into suprascapular artery. Next one is costocervical trunk. Costocervical trunk divides into 2 branches. One is deep cervical artery and another one is supreme intercostal artery.